here. But this is all data that is on the South Dakota Department of Health website about reportable diseases. And if you guys were here last year, remember we looked at the same thing. So our category 1 diseases versus our category 2s. Our category 1s, those are report immediately. And our category 2s are within 30 days. I'm not going to go through all these. This is stuff that you guys can find online. The one I'm going to talk a little bit about is some of the confirmed and probable cases and some of the trends that we're still seeing today. So you guys have probably seen the commercials on TV that Department of Health and then also their travel partners have put out talking about the rise in STDs. The last 3 years have been off the charts. You can see right here some of the STDs. Let me see if I can highlight them here. Like chlamydia right here, that's gone up considerably. And from 2019, it has gone up over 100% from what the DOH gals in my office are telling me. So this is kind of, they're calling it an epidemic. So the Department of Health has added a lot of contact tracers. You guys probably remember those words from COVID, right? Contact tracing. So they're doing this for all the infectious diseases in South Dakota as well. Some of these other ones out here, HIV and AIDS, that's another one it's held somewhat steady over the years, but in 2020 through 2023 or 2022, this has gone up as well. And then Doc Owens was talking about some of the other ones that they're working on, like polio. That's showing a national trend again of getting going. Nothing really in South Dakota that I've heard about or seen. But this is all information that's available out there on South Dakota Department of Health website. And it sounds like you're gonna see some updated stuff here within the next couple of months from 2020, 2021, and 2022. And the reason why they haven't gotten this stuff updated is because they were focusing a lot of their efforts and resources on the COVID pandemic. So that's kind of the reason why we haven't seen much updates here. Just a couple of other things that we're going to touch on. All right, so we're going to talk just a little bit about, those possibilities for infectious disease and how we're going to keep ourselves safe. So let me find the slides that we're going to talk about. There we go. So obviously, we want to try to prevent disease in our responders. That's our main goal, right? How do we do that? It's easy, right? Don't go to calls where people are sick, right? No, that's not it. How do we protect ourselves? PPE, exactly. And what are some other ways we can protect ourselves? What's that? Hand washing, all that good stuff, right? And I'm not going to start the vaccination war. Doc Owens tried to earlier. If you're an EMS professional, get those vaccinations that you need to get. If you have other beliefs, that's fine. Totally respect that. But that also helps our EMS providers from getting sick. There we go. So our communicable diseases, let me check this. Oh, okay. You guys remember a couple years ago, we started a vaccination war on the chat box. Didn't want to do that this year. So our communicable diseases, they're spread from one person to another, from one species to another. A lot of stuff that we've learned through CDC. I mean, I never really knew what CDC did before the COVID outbreak. And they got a lot of really good information on their webpage. And for you guys to get that information, just go on there and go ahead and look for the stuff that you're looking for. A lot of good information out there. Our Department of Health in South Dakota has like a direct line with CDC. They have meetings with the CDC all the time, and CDC is always gathering data to help combat some of these outbreaks that are having. CDC is very much in tune with the STD outbreaks that we're seeing on some of the reservation populations in South Dakota. So they're helping, they're dumping federal dollars into our state and those reservation healthcare systems to combat that, because you're starting to see more severe diseases that are being found out there. So to give you an idea on the contact tracing that the Department of Health does and how they do it, is they'll start just with a simple phone number of maybe somebody who came into contact with that person or a sexual partner of that person, depending on what type of disease it is. And then they just start investigating from there. Sometimes, and I asked them last week, kind of just tell me how you guys do this. So they'll talk to that person, they'll get information, then maybe that person's been in contact, similar to how the COVID deal went early on. You guys remember that? There was all this hoopla about, well, I didn't get a phone call for 10 days after I was exposed to COVID. Well, you had about 40 people working on that. And I mean, they did their best. I saw it. They would work from 6 in the morning till 10 at night, every day of the week, trying to get caught up, and they just couldn't do it. And I really felt bad for them with how bad they got hammered in the media and even on social media, is because people didn't understand it. Just like us as EMS providers, sometimes, we get hammered for certain things and people just don't get it. So just be careful and be respectful, of those types of situations. And, we can all help each other out a little bit in that sense. So carrying on with our infectious and communicable diseases, just like we said, our preventive techniques, our immunizations, our hand washing. Understand what bloodborne pathogens are. How many of your services have bloodborne pathogen programs? You don't, you need one. Does it need to be a huge, robust program? No, it needs to be a one-page document that says if you get exposed or you potentially were exposed to blood or body fluids, that now you've entered into that program. You go and you get, depending on what the situation is, you may get your blood drawn as a baseline, and then you may have to go in every 3-4 months, have that happen again. You can have a bloodborne pathogen like supervisor or leader who kind of runs that program. It's all confidential within your agency, that you need to have that ability to document those things. Because if you don't, and you happen to come down with something that you got while you were on a call and you didn't document it when it happened or when it potentially could have happened, you guys think work comp's going to cover that? Work comp tries to get out of things that are witnessed, right? So they're not going to cover that. So if you have that happen to you, or you get exposed to blood or body fluids, make sure you're getting it documented. Because if you now come down with something that falls into the assumed type of diseases that you get while you're on a call, you're now covered, and you're able to get some of those benefits that are available to you. That kind of fits in that exposure side of things. Our PPE, let's talk about that a little bit. Gloves, gown, mask, eye protection, face shield. We're still getting calls and they still tell us what? PPE required. What's that mean? They probably have COVID or they have influenza. They tested positive for something. When we go charging in there with no mask on or no gloves on, what are we doing? We're setting ourselves up to get whatever they have. So just because that we've grown accustomed to the COVID side of things, don't forget to wear your masks and your face shields and your eye protection and things like that when you're going on these calls, because it's only going to protect you. And when we have only 4, 5, 6 people running calls in your town, if we take 1 or 2 of you out of it, I mean, that just stresses the system. even to the max. I know when the COVID was at its peak, there was multiple agencies who were reaching out to other EMTs to help them because they maybe had an entire crew get exposed to COVID and they'd shut them down. You know, early on, that's what they were doing. So you pretty much had a quarantine if you were exposed early on. So when you get an entire EMS crew that's hit with that, or hit with being exposed to a communicable type disease, that just taxes your system completely. So make sure you're protecting yourselves when you're going onto these calls. And if it says PPE required, that means PPE required. That means your normal stuff plus the body substance isolation stuff that you were wearing during the COVID side of things. So just don't forget that and don't become immune to it, because we don't want to hear our EMS providers getting sick. We don't want to have you guys out of service because you were exposed or got a disease. As far as donning and doffing, understand how to wear your PPE. How many times did we see the mask side of thing? I'm not going to start a mask war either, but we were wearing masks, but where were they? They were down here, right? They weren't doing anything. And you can believe in what you want on masks, and I totally respect it. But the N95s right now is what they're saying is stopping some of these airborne viruses like the flu and COVID and things like that. So make sure you're wearing your N95s. Make sure you're wearing them correctly. Make sure you're getting fit tested on those N95s. If you've never been fit tested on those, you might be wearing the wrong one and you're not protecting yourself. How do you remove it? If you have something that's on that PPE, make sure you remove it carefully and the way that you've been taught through your trainings, to where you don't become exposed while you're taking your PPE off. That's the worst possible way. You've gotten through that entire call and you haven't gotten exposed, and now you're taking your PPE off and now you get exposed to those blood or body fluids. That's not the place that you want to get exposed. You've done real good, and then doffing it, you get exposed. Washing hands. If you can't wash your hands, go ahead and use the alcohol-based hand washing solution. There's some real crap still floating around in this. Some of that stuff that came straight out of the ethanol tanks, pretty much, that stuff is harsh. Wear our gloves. The nitrile gloves are effective protection. Make sure we're using an approved Cavicide wipe, Cavicide spray, things like that. Is it okay to use the Lysol wipes right off the shelf at the dollar store or whatever? It's probably all right, but use a medical grade type of disinfectant to disinfect your rigs and your equipment. Eye protection. This is one thing that I said right away when face shields were one of the things that kind of came out for COVID. Face shields are going to stay with us. We've always had them, but the ability to wear them and still see what you're doing and protect your face, I think it's one of those things that's going to stay with us a little bit more. Our safety glasses, that should be just as common as your gloves. Should be gloves, safety glasses, and then the ability to wear some sort of a mask if you're dealing with someone who has the airborne type of illnesses that can be spread that way. Gowns, when you're getting into those situations like we talked about last night, the field delivery of a baby, good idea to wear a gown. And in those major trauma scenarios or situations, when you're walking into those multi-casualty type incidents, if you have those gowns available to you, put them on. All they're going to do is give you an extra layer of protection when you're getting down and dirty with some of those situations. Masks, we're not going to talk a lot about that. The N95s is really what's working right now to take care of these communicable diseases. If you're masking yourself and your patient doesn't have a mask on, go ahead and mask your patient as well. When we're doing CPR, make sure you're using a barrier device, whether it's a bag mask device, the pocket mask, any of those types of barrier devices are going to keep you safe as well. If you're using sharps in your ambulance, those of you that are doing the epi draws, now you have another sharps, or now you have sharps. But even like your Lancets that you're using to take blood sugars, those need to get put into a approved sharps container. They can't just get thrown in the trash, because yes, it retracts back in there, but what if it doesn't work right? And now you have the ability, when you're rifling through the trash, to dump it, or to find that glove that you wrote those vitals on. How often we do that? We do that a lot, right? Now you get poked by that sharps. Now you just entered into the bloodborne pathogen program. Not a program you want to be in, really. It's not one of them clubs that has a, you know, that you get voted in, and you just happen to get in it if you get exposed. All right. Any questions on this? Like I said, this one's going to be kind of down and dirty. Anybody have any questions, comments, concerns? All right, let's go ahead and take a break until about 5 minutes to 2, or let's see, right at 2. Let's get right back to 2 o'clock. Take a break. There's more pizza out here for those of you guys and gals online. We'll be back ready to go at 2 p.m. Make sure you're doing your assessments.